Welcome to the Navigating Dental Insurance Podcast, where we don't take from insurance companies. Here are your hosts, Mr. Jordon Comstock and Mr. Ben Tuine.
Shut up, I'm recording!
Welcome to another exciting episode of the Say No to PPO's podcast series on the Navigating Dental Insurance Podcast. I'm your co-host, Jordon Comstock, and I got Ben Tuine on the line. Ben, how's it going, man?
What's up, Jordan? Good, man. How you doing? How was your campouts? The listeners want to know how the daddy and daughter campout went for you.
I woke up the next morning, and my entire neck and shoulders were killing me because I slept wrong, and then I woke up, and my daughter was like halfway across my face.
Yeah.
Because she sleeps weird, I guess, and it was rough. But we had a lot of fun.
Yeah.
And I got my twin brother to come with me. And I'm like, hey, dude, you should just come camping and bring your boys. And he gets there and he's like, wait, is this a daddy-daughter camp out? I'm like, yeah, sorry, I didn't tell you about that. I'm like, I just wanted you to come camping with me, man.
Yeah.
But no, we had fun. It's been a good camping season. I'm gonna go again here soon. So but we had a blast, and it's good to be back and busy again. So
yeah, I hear you, man. My best campouts are at the Hotel Hilton and the Marriott. Every time I go out camping, the last time my son and I went out camping, he had such a blast. We got this huge tent. Bought these fluffy big sleeping bags, and I put them down. And it says you don't need a mattress, you don't need a cot, you don't need anything. Just sleep on them and they'll be super comfy. Well, that's if you weigh like 95 pounds, because I lay on it.
That's fine. Yeah.
I feel every pebble beneath me, and I'm like,
oh boy,
I just can't get comfortable. And I look at my son, and he's sleeping in this 6-foot sleeping bag, the same one that I'm sleeping in, and he's snoring, he's having sweet dreams, and here I am with backaches. Yeah, no sleep whatsoever, and like, oh, screw this. So I get up and go out and roast some marshmallows or something. But
go cook some meat over the fire.
Yeah, I bought new cots though, because next time I go, I'm just gonna take the cots and sleep on them. Use a sleeping bag to sleep on them. But
that's better. Yeah. I bought an air mattress, but I own the purple mattress. I don't know if anyone's familiar with that.
Yes.
Or if you're familiar with it, and it's amazing, right?
Does it really keep you cool at night?
Oh, dude, it's an awesome bed. Like, purplemattress.com, I think is the website, or purple. I can't remember the website, but it's Purple Mattress is the name, and started by some brothers here in Utah, and it's like a multi-billion-dollar industry in like less than a year.
Yeah, my neighbor,
company, I should say.
One of my neighbors runs a charity called Sleep in Heavenly Peace.
Uh-huh.
And they make beds. Their mission is that no child sleeps on the floor is their mission. Yeah. And they just met with Purple yesterday. Met with the executives here. Yep. And because they get a lot of returns, and they don't send the returns back to recycle through and resell them, so they just toss them. They give them away.
Wow.
So they're giving them away. Well, I probably shouldn't make that public announcement. I don't know if I'm gonna get in trouble. But anyway, okay. I want to get a Purple mattress. Because Islanders, we have this thing called the lava. A lot of you may have heard of it, where it's like a skirt, or what the Scottish people wear. What is it?
Yeah. I have Samoans that live in my neighborhood. They're always wearing that stuff.
Yeah, it's easy access to coolness, but also easy access to making children and all that other fun stuff. So you look at the Purple mattress, it's like, yeah, I know where they got that idea. You have these holes in there that makes it easy for the air to flow through, but.
Yeah, it's really cool technology, and so I love it. But then every time I go camping or I go to a hotel, I wake up miserable the next morning because I'm so used to this awesome mattress.
Yeah.
So
well, cool.
That's my story there.
Cool.
So today, Ben, you and I are going to be talking about a lot of common questions we've been hearing from our users and customers. A lot of it will be some about UCR fees and some about membership programs and other insurance topics. But I want to get the show started, Ben, and talk about these things. So UCR fees. What are they, Ben?
Yeah, UCR, there's various different interpretation of what UCR is. The official definition, UCR, usual, customary, and reasonable. A lot of doctors and staff members across the country, it's interesting, they believe that UCR is the allowable set by the insurance carrier.
Uh-huh.
And in my opinion, that's not correct. If you give the insurance carrier definition over UCR, what that does, it drives down the cost of care, which could be amazing for the public, but it won't be amazing for the doctors and the vendors that are
On
trying
the
so hard,
business side.
right?
Yeah.
Because you're underpricing dentistry far below what's considered sustainable for certain types of treatment. So according to healthcare.gov, this is their definition. UCR, usual, customary, and reasonable. The amount paid for a medical service in a geographic area based on what providers in the area usually charge for the same or similar medical services. The UCR amount sometimes is used to determine the allowed amount. So they're talking about the allowed amount with insurance carriers. Yeah, exactly. So the problem with a lot of offices out there that interpret UCR as the insurance allowable, many of those offices don't have a UCR. They simply don't have one. They have all the insurance fees, and then for their uninsured patients, they just charge them the Delta rates, the Delta Premier rates.
Oh boy, yeah.
And
is that bad or good?
That's bad. That's not good.
Yeah.
The danger in that
sounds bad.
Yeah, it's not good, because when you think about the insurance industry, for years and years and years, the insurance industry has tried to fight and control the definition behind UCR. I don't know if you know a company called Ingenix. Are you familiar with them? You heard of them?
I think I've heard of them, but I'm not too familiar with what they do.
So Ingenix, if you bought a fee schedule analysis before the year 2009, whether it was through a vendor or through NDAS or most other institutions that are out there, a lot of companies got UCR feedback from a company called Ingenix. So Ingenix is a database. It's a company that gathers fee schedules, information from every medical industry, chiropractors,
Okay, so they're
dentists.
like a market research for the medical industry.
That's right. And so for the longest time, they were creating, or at least controlling, the UCR definition. Well, do you know who owns Ingenix?
I'm guessing a really big insurance company.
Yeah. One called United Healthcare.
Oh, wow. Okay. Interesting.
So long story short, the state of New York stepped in because the problem in New York is that a lot of specialists on the medical side and even on the dental side, these specialists didn't have any reason to participate with insurance because they really and truly were exclusive in their specialty, meaning for hundreds and hundreds of miles, there were not any other specialists of their type. And so patients had no choice but to see those specialists. So problem number one was the insurance allowable, the UCR. What they considered UCR was far lower than what these specialists set on their own. And as a result, these specialists being fully fee-for-service and out-of-network with every insurance plan, they didn't need to join any insurance plan or as a participating provider because they had such high demand. So consequently, the patients were paying a significantly higher out-of-pocket expense. And that's because the insurance allowable, or back then the UCR, was driven down. So you can go in for back surgery, and a doctor could charge $10,000 for the procedure, a specialist. And this is just an example; these aren't real numbers, but this is along the same lines of that case, that study, is that $10,000 for the surgery. But the plan allowable, because the doctor is out of network, the insurance company will only allow up to a certain amount for the same surgery, was only $1,500. So the patient may get a $1,500 covered benefit in the event where this is covered at 100%. And then whatever the difference is between that $1,500 and $10,000, the patients had to pay the specialist fully out of pocket for that.
Yeah.
State of New York came in and said, this isn't right. Why are patients incurring a significantly higher amount when they see an out-of-network provider? So they asked all the insurance carriers out there, how do you define your allowable? How do you define UCR? The insurance industry didn't have a good response for that because they knew that they had Ingenix that was giving them this feedback about where the allowable should be on the out-of-network side and even the in-network side for a $10,000 back surgery. So state of New York didn't like that, and they sued all the insurance carriers, took them to court. But
Wow.
the bad thing about this case in particular was the insurance carriers put together $100 million. They all came together and said, let's all pitch in. Let's pay the state of New York to keep this out of the courts. And that's exactly what happened. It kept it out of the court. So it's called the Fair Health, what do they call it? Fair Health Mission or Fair Health Cause, in an effort to have a non-biased institution determine what the UCR definition is for every part of the country, every industry in medicine. So the state of New York took that money, $100 million. I think they gave it to a university. I think it was the University of Buffalo, but I do know that Fair Health is housed at a state university up there in New York. But if you go to fairhealthconsumer.org or fairhealth.org, you'll find what the exact recommendation for UCR is in every community. And they recommend that the maximum UCR, or at least an acceptable UCR, is the 80th percentile. The 80th percentile according to Fair Health, not according to all these other companies that are out there that are defining fee schedule percentiles. So as a result of the state of New York taking that money, and part of that settlement was all the insurance carriers combined, everybody that participated and paid money to the state of New York, agreed to follow Fair Health's assessment of UCR. So when you read on the Fair Health website, a lot of the insurance carriers list there, they will say that we agree to follow the 80th percentile as an acceptable UCR. Some of them are at the 60th or 70th percentile. And basically what that means is
real
that's
quick,
their...
Ben.
Yeah.
I was going to ask, because I'm sure we have people that are in school studying dentistry. What does it mean for the 80th percentile?
Yeah, so the 80th percentile, according to Fair Health, is, in their opinion, the maximum recommended UCR in every community. And their definition is different than the ADA's definition, but the 80th percentile, for the most part, in their opinion, is consistent, meaning that out of 10 dentists, if you're at the 80th percentile, you're number 8, in terms of ranking on how high you are. But I wouldn't be intimidated by the 80th percentile because, I mean, go for yourself and check it out. Go to fairhealthconsumer.org. Put in D2740 for porcelain all ceramic, or if you're an endodontist, D33304 for a molar endo or molar root canal, and check out what the fees are. You're going to be surprised at how reasonably set the 80th percentile is compared to other institutions that are out there. So are you overpriced at the 80th percentile? I don't think so. But the reason why you want to consider the 80th percentile according to Fair Health is because that's the benchmark that most insurance carriers have been asked to use when assessing allowables for out-of-network. So anyway, that's a long-winded answer what UCR is. But
no, I love it. No, that's I think that's great. And you told a cool story there too that I thought was interesting about Fair Health. That they have Fair Health Cause, right? Was that?
Yeah. So it was Andrew Cuomo, who's the current governor of the state of New York. Back when he was Attorney General, he thought and created this idea that there has to be a fair way of assessing reasonable prices for medicine. And so he put together this whole Fair Health organization. It's a not-for-profit organization that is designed to be a consumer advocate organization to help consumers know what the real cost of medicine is.
Yeah.
And as a result of them doing this whole, suing all the insurance carriers, most insurance carriers that underwrite dental and health have been asked to follow the Fair Health definitions. Are they following it today? No. A lot of them have veered away because it was a settlement. It wasn't case law. So I don't know what the stipulations and terms are in terms of how long they had to follow it, but some insurance carriers are still following it. Some aren't. So, but essentially UCR, that's set by the providers in every given community.
So I was going to ask, so the UCR is set by the providers, meaning the dentists, right, in this case?
Yep.
And that varies from state to state because every market is slightly different, which makes sense. So can a practice charge more or less their UCR? Does that make sense?
Good question. A provider can't charge any more than what they list as their official fee. And it's no different than you going to the grocery store and they
It's
advertise
like
on their
MSRP or whatever it's called. Okay.
$4 a pound for this piece of ribeye steak, and you add the taxes on there, but they can't charge any more than that. And cell phone companies have gotten in trouble with this in the past, where they advertise a price and then they tack on all these ridiculous fees to inflate the price to cover whatever, give whoever needs a commission in that whole chain. But for the most part, if you have a listed UCR, you can't do what the cell phone industries used to do and raise and add all these different fees to inflate the price of your UCR. Whatever your UCR is, you can't go beyond that. So it's your yeah. Go ahead.
So yeah, it's basically the suggested price or the charge, to the patient. So, just like is it MSRP? That's right?
Yeah.
Like, what does that stand for in the retail sector? It basically says, okay, these are what you should charge. If you're charging more than this, then you should relook at your fees, because you're charging way more than what the market can bear.
Yeah. So MSRP is manufacturer's suggested retail
recommended
price.
Yeah,
right.
Suggested retail. Yep, that's right.
So
that's right.
MSRP, the difference between MSRP and UCR is that the MSRP is a suggestion. You can charge more or less than that.
Oh, I see. Okay.
A UCR
UCR is solid.
That
right?
is the official flagship standard of fees in a practice. And you can't charge beyond that. I mean, it's unethical to do that. But
what if your costs are higher than other practices?
Then you can raise it. You can raise the UCR.
You can raise it? Okay.
That's right.
You can raise the if your costs are higher than the practice down the street, because maybe you invest in like all the latest technology, you can increase your UCR.
You can. You definitely can. But you want to be careful with that, though, because there's some, I mean, I deal with clients that in the same community, one doctor will charge $1,200 a crown, and the office right next door will charge $2,300 a crown.
Wow.
And you see far less volume in the practices that are priced that high. They do the quote unquote concierge dentistry. Yep. And in the end, the market will dictate what the price should be. The invisible hand of the market, if you will, the economic classes that we used to take in college, that there's a price point that's invisible that the market will bear. And usually what the price point is, if you go beyond that, you're going to have a tough time capturing a significant amount of patients. I mean, you can have lower volume, and, some doctors feel that, I have lower volume, but get far greater, a higher payment from patients. But the other thing is, these practices that do $2,300 units per crown, that's their UCR. They're using the exact same lab as the guy that's charging $1,200.
So their profit margins are a lot healthier.
Yeah,
it seems like
they're getting $99 on their zirconia from the same lab.
They're charging $2,300.
Yeah, you just have to be careful, because in the end, you have to consider the invisible hand of the market in terms of pricing.
Yes, I agree with that 100%.
But I believe if you have any question you have to have a balanced UCR, and go to Fair Health. Go to feeestimator.org. If you Google Fair Health promotional, what do they call it? Promo codes.
Promo code.
There's several companies that have promo codes to purchase. You can purchase. I did one just earlier today for a client for $200, $230, but you can get a full assessment of what the 80th percentile is, or at least it gives you a range.
In your location.
Yeah, it gives you I think the 50th to the 90th percentile on that fee schedule report. And the beauty about that is you can measure and see where you're at compared to the most balanced fee schedule, which is, in my opinion, Fair Health.
And they've done all the market research essentially, right, for the practice that's what you're paying for. I'm assuming, right?
That's right. So they actually get the data from the insurance company. So whenever you bill an insurance carrier, that's one area that they get the data from. Is those insurance carriers agree to share that data with Fair Health. The other area,
interesting.
I was speaking to Fair Health. I need to get updated on this, but they told me that they also get the data from different databases that are out there, but they also take it further and they look at the cost of living, the cost
that makes sense.
rent.
I was going to ask about that. Cost of rent,
cost of payroll,
just the cost of living.
So they factor
in each state.
Exactly, they factor that all in to come up with the percentiles, And that's why, to me, it's the most accurate. The problem with a lot of organizations, which I won't mention out there because I think those are great organizations that just don't have the fee schedule analysis right, is what they do is they compare the fees among the subscribers. So for some organizations, they only have fee-for-service doctors that are very expensive.
Yeah, I was going to say that's probably, you've got a diverse, you can either have a diverse amount of practice in that database, or you can have practices that are just collecting data from fee-for-service patients.
That's
right? Or practices.
That's right. So Fair Health to me is a visible,
pretty balanced.
Yeah, it's a visible, it's the visible, invisible hand of the market, in terms of they do the right research to determine the price points on what the market will bear for any given procedure in that zip code. So check it out, fairhealthconsumer.org or feeestimator.org. And no, we don't get a commission for sending you there.
No, we don't. No, we don't. So feeestimator.org is owned by Fair Health.
That's their provider portal. You can go there and as a physician, an OB, a dentist, a DDS, DMD, a veterinarian, chiropractor, you can go.
Oh, cool.
So that website is specifically for doctors, providers.
No, I love that there's some form of research out there that doctors can go to, because I remember even just starting my company, we're like, what should we charge? And there's nothing like that for me other than other software companies that we can kind of gauge from, and then ROI assessments and things like that.
Yeah,
but that's a great resource.
It is.
That I wish I could have had in my business, and I'm sure I don't know if they do anything like that for you, Ben, in your line of work. But you probably had to do your own research.
Yeah, we did.
Right?
Yeah. This cuts
that
out
takes a lot of time.
Jordan, you asked in the beginning before the podcast, whether you can discount off of your UCR. Can you charge lower? And yeah, you can. There's no law. The only law that's out there is one written by Delta Dental, which is not state or federal law. And Delta says you can't.
It's just Delta law.
Yeah, that whatever you charge on your uninsured patient-based side of things, that they're going to want that too. But you tell me, how can Delta know that without violating HIPAA? Like how can you disclose that to them unless you agree to say we're going to white out all the patient information? But frankly, what I do for my uninsured patients is none of your business, Delta.
Yeah, because they're not Delta's patients, because a Delta insured patient is a Delta customer.
So when they ask, do you discount fees for the uninsured? I mean, the appropriate answer to that is, I'm sorry, you're not entitled to know that, because you only govern Delta Dental. And
you don't govern the world.
You don't govern all the other patients with other insurances and the uninsured. But I haven't had. So we use the same law firm that you use, Jordan, Smart Schofield down in Salt Lake City.
Yeah.
And then we used one in Tempe, Arizona. I can't remember the name. It's not coming to mind. But these are two of the largest firms in each of their states. Like Smart Schofield is the largest law firm here.
Big firm.
Yep.
Yeah.
And they combed the entire United States to find if there was any law that would penalize a doctor for offering a discount to the uninsured. They couldn't find anything. Funny thing is when they did this analysis, I happened to not have, I missed the open enrollment for medical that year, a few years ago, and I didn't renew my medical plan, and this was by pure accident. And so we had to go in for our son's pediatrician visits, and even for my wife and myself. The standard is you don't have insurance, you get a 25% discount.
Yeah. Yep.
That happens in every industry.
I had the same issue last year too. I, for some reason, didn't make open enrollment or whatever. So I was like 6 months without insurance, or I don't remember the length of time. But every office I went to, like, took my little daughter to, and they would always give us discounts because we weren't using our insurance.
Yeah. Yeah, that's. I mean, it's practice. It's been in practice in medicine for a number of years. So many doctors that are fearful of doing that. I don't think you need to fear.
I don't know if this is a myth, but a lot of people say that that's against the law.
Show me the law. My first question to the.
I was talking to a nurse.
Yeah.
Now this is not in dental. This is a nurse, and I was saying my daughter has the tendency to dislocate her elbow, the nurse's made elbow. She's got really weak elbows, and she'll fall and knock it out or something. But basically I called my neighbor who's a nurse over to come and help her, and she's like, oh, I'm glad she helped her out. And she's like, oh, I'm glad you didn't have to go to the emergency room. That would cost a fortune. I'm like, well, what if I just didn't use my insurance? Could I get just a discount? She's like, well, I think that's illegal. I'm like, well, it's my choice. Why is that illegal?
Yeah.
Right.
That brings
up
like
your story, Ben, right?
Yeah.
Your bigger story was a bigger deal than like a dislocated elbow with your son and your wife. You chose not to go through your insurance so you could get the best quality care.
That's exactly right. And as a matter of fact, these days there was a news article, when was it? Here in Utah, just about 3 or 4 months ago, and they actually talked about dentistry. They talked about chiropractic work and all that other stuff. And this news organization found that you can get a better deal if you don't use your insurance.
Of course, yeah.
And simply because the cost of administering a claim
insurance
is high. So usually, like if you go to a doctor's practice and you get you ask for X procedure, maybe a crown or maybe a root canal, and the insurance allowable, and the example they used was that the insurance allowable was $1,000, which means that you're out of pocket 50% coverage, you pay $500. But if you go to the doctor directly, they'll do it for, let's say $450, so knock $50 off. That wasn't the exact example. A root canal was a procedure where they could afford to discount it below what the patient's copayment would have been anyway. And when you have a high deductible, you know that you're not going to meet it that year, you can actually save money if you just ask the doctor for a discount directly. As a matter of fact, this whole dental insurance concept, the studies that we looked at, if you pursue the dentist directly without insurance and ask for a discount over a 5-year period, if your discount is 10%, you could save 25% overall in terms of your over dental insurance.
Over your yearly or monthly premiums for dental insurance.
Exactly.
Well, and I have a story about that too, because I was one of my co-founders. He's one of our head developers. He's had a lot of dental work this past year. Him and his wife both, and he uses a local dentist that's a good friend of mine. And he's on a certain insurance plan, which I won't name, but we did an analysis on his case. Because he had to get a couple implants, and he's had to get some work over the past few months. It's been just a pain. It's a pain in the butt for him. Right. But he did an analysis. He's like, look, my insurance got capped, right? Or what they're gonna pay capped out at like $1,000. It's pretty typical.
Right.
He's like, I've had to pay all this out of pocket, and the insurance premium for my whole family every month. So it's like it increases, inflates the whole market, right? So he's like, for dental care, I've paid so much this year because I am on insurance. If I was not on insurance, I would be paying far less, and being, smiling more because I'd be paying less,
Yeah.
And it's kind of interesting to think that way, because it's like, well, yeah, insurance does inflate the market if you think about it.
It really does.
Right?
It really does. As a matter of fact, we should talk about that, and maybe I'll do
in another episode in detail.
Yeah, because I actually started to do the research on it, and what I found is that, oh gosh, I'm trying to remember the specifics about the case that I found. It was an emergency room case that just, oh gosh, but anyway. We waived. We decided to pay cash and then just submit the claims to insurance afterwards.
Yeah.
And what we found was our cash discount was cheaper than what the insurance allowable was for that procedure. The insurance allowable was significantly higher, which, and it was I was confused when I got that EOB, because I thought to myself, the first thought I had was, insurance is driving the cost of healthcare up. They're not controlling it. They're making it increasingly more expensive. But when I went to the providers directly, they gave me a much bigger discount, which begs the question, what role does insurance have in the industry? I think it's a great thing if you're looking at catastrophic care, but something's broken in the system, especially on the dental side, that's not fixing things. It's undercutting the dentist and what they get paid. And then on the medical side, it definitely is driving up the cost of care, where you can get a bigger discount if you just go to the doctors directly on a number of procedures. And that's usually how we do things now, is whenever we go to the doctor, we tell them just bill us directly and then help us prepare a claim, and we'll submit it on our end. But we'll pay you right now, the fee-for-service model. And so far in doing that, we get better coverage on that. And it seems to make the doctors much more happy. I
was going to say, it probably makes the office a lot happier too.
Yeah, we always tell them, we'll pay you now, but just give us the claim and I'll go ahead and submit it. I know how these things work, so I'm just curious myself and willing and able, but it's virtually impossible to get every patient to do that. If you're accepting assignment of benefit, it takes time to learn how to do that,
Yeah,
so don't go doing that tomorrow.
I'd never do that, but I'm getting ready to sign up for. My dentist is getting ready to sign up with our membership software, and I'm going to be his first member.
That's awesome.
Because I don't have dental insurance, right?
Yeah.
And I never will. And so I'm kind of excited to see how that goes to be a patient in a practice that has a membership program. I think it's kind of cool.
Yeah, let's talk about that for a second, because we get a lot of questions on dental benefits and regulations.
Yeah.
Go ahead.
And before we jump there, when it comes to like UCR fees and membership programs, in your experience, Ben, how should a practice kind of go about that? They're obviously able to discount.
Yep.
But they just use the standard UCR that's suggested by, let's say, Fair Health.
Yep.
They use that and they go, because that's a question I get all the time from practices on the topic of UCRs. Like, should I use my UCR fee? I'm like, oh yeah, don't use what Delta is making you do, right?
Your UCR, your UCR is the benchmark. That is the standard, the gold standard of where fees are discounted from. And so
use that.
Yeah, you use
that as a start.
You use it as starting point, but you can create, for a membership program, you can create a separate fee schedule, and that can be considered the member benefit fee schedule, and it's just like a PPO fee schedule that you put in there. And
one you essentially manage.
Exactly. So when patients call you, essentially that's what you're selling them, is you're selling them that discount. No different than an insurance carrier selling them the discount that you provide them in the form of insurance. So yeah, my recommendation is always use the UCR. Use a higher percentile, if possible, if you can do that. And that way you're...
By higher 80th, right, is what you're saying?
Yeah, 80th or 90th. I recommend to my clients that they set theirs at the 80th or 90th percentile. And the reason being is because over 90% of their patient base has insurance. So your UCRs are insignificant in terms of income, but they are significant in terms of negotiations. You have a higher standard of a fee to negotiate with insurance carriers, but when it comes to dental benefit, you can illustrate a higher discount or percentage level, Yeah. And so like it's kind of like the whole concept when you go to the factory mall outlet. The factory malls, I don't know if you've I read an article the other day, but the factory mall concept is becoming widely more popular than traditional malls, the traditional retail malls. And the reason why is because it's the perception discount. So you've been to Traverse Mountain, Jordan, the mall there?
Oh, yeah.
You've been to Park City?
The street. I've been to Park City, yep.
Have you noticed that they're always full? Most days?
The
Park City's almost always full.
Traverse Mountain? Yeah. Park City's always full, it seems like.
Traverse Mountain.
I go to Traverse Mountain more because I'm closer. But
it took time. When that mall first opened, it took time for it to build up. And when you go there in the evenings, it's always packed. And I would argue that there's more traffic going through those malls than there are the standard retail malls in Provo, up in South in Murray, where the Cheesecake Factory is. And and it's because of the perception discount. So those discounts are inflated. Like when they say 70% discount, it's like they throw a number on the wall. We're going to charge you $1,000 for this purse. Oh, but we're gonna reduce it by 70%. So it's only it's only $300. It is.
It's marketing psychology.
You're illustrating a higher discount, and even Dr. Phelps. Remember with his patient?
In his episodes, he does a few things like that too. It's called what's the technique? It's called
persuasion.
It's persuasion is the overall technique, but that's a certain like step. I can't remember right now off the top of my head. The law of something it's called.
Law of attraction.
Not law of attraction, law of
The law of being swindled by
contracts.
discounts.
Law of
Concepts.
contracts.
Oh, there we go. Law of
Contracts, because then you can say, look, our normal price is $1,000, but today if you sign up, or if you buy this purse today, we'll give you 70% off.
Yeah,
right. So it's the law of contrast, which really is it works.
It's
right.
the law of contract and the fear of loss. The fear of losing that discount. And
yeah, exactly.
And really, that's the whole point.
It's two things actually.
I mean, I know a lot of doctors are like getting ready to throw up because they're like, I don't want my practice to be that way. But the reality is that these are wonderful techniques to illustrate value and also to encourage people to move forward with treatment. This is a case presentation technique that we're talking about.
Yeah, and like Dr. Phelps says in his episode, you could, and in the book that he recommends about persuasion, you could use these principles, these tactics for good or for bad, right? It just depends on, so hopefully most people use them for good, but there's obviously people out there that use them for bad.
Yeah.
But I think that's an interesting point that came up there about just talking about fees and pricing them.
And that's why I recommend the 80th or 90th percentile, because the idea is to set your in-house membership fees at either the 50th or 60th percentile. So the higher your fees are, the higher your discount illustration is to the patients. And even when your treatment, when you get the EOB back,
they feel like they're getting.
You submit your EOB, the claim. The EOB comes back on a Delta claim or a Cigna or any others. The discounts, we're so scared of them, and rightfully so. We're just sick of insurance carriers discounting our fees. But if they've been negotiated and they're set and it's still a 20% discount, claim it. Don't let the insurance carrier take all the benefits saying, oh, we negotiated a great deal with your doctor. When I used to treatment plan and sit with patients, I used to say, and the fee that we're offering you through your insurance that we are giving to you today is 23% off. And we would claim it for customer service. And, we're then getting ready to ask that person for a referral, referring their friends and family, and giving us a review online. And you want to use that write-off tool to your benefit. Don't just let it get posted as a write-off. Use it to your benefit to get patients to like you, to build that loyalty factor.
Absolutely. Yeah, I agree with that 100%.
Not that they hate you, but you know what I mean.
yeah. Maybe some doctors, you never know, right? Last thing we'll talk about, Ben, is the regulations. Sorry, I just wanted to kind of talk about the UCRs for membership programs and stuff like that.
Yeah, for sure.
Regulations, it's like one of the questions I get on a daily basis about membership programs. In my state, I've heard it's illegal to run a membership program.
Yeah, it's illegal to not floss your teeth, It's illegal to not brush your teeth too.
Yeah, exactly.
Let's start making up laws.
I'm going to start making up laws. Yeah, it sounds fun. And then I can call myself a lawmaker.
There you go. Then you'll go to jail then.
then I'll go to jail, but membership programs aren't illegal. There are regulations, much like any other state or any other product you're trying to sell, whether in dentistry or outside of dentistry, there's regulations. But there's some practices and doctors kind of overthink the regulation piece, but in reality, it's very simple. A lot of states a lot of practices in certain states, have regulations on having agreements, which I would recommend that anyways with doing any form of business. Another thing is, telling practices that membership programs, or telling patients, that membership programs are not insurance. That's pretty standard. But the other day I was talking to an office that was looking to sign up with our software that helps create and manage membership programs.
Yeah.
And they're like, we're ready to sign up, but we're just afraid of the regulations. I'm like, afraid of the regulations? Like, you guys shouldn't be afraid of the regulations, because they're here to protect the patient and the practice, right? It's not necessarily to screw you over, right?
Yeah.
And basically I said, you know what, I'm willing to help you look at this. Was in Oklahoma, and I said, I'm willing to look at this for you. It's not that hard. Practices think it's extremely hard to find these regulations. I have found them. I found a whole website that talks about the standard regulations. If your state's not on there, I simply call the insurance commissioner and say, this is what I want to do in your state. What are the regulations, if any? And Oklahoma, they sent us to the insurance commissioner, the legal department there.
Yeah.
And we talked with this awesome attorney there that works for the insurance commissioner. And she has helped us, and she's like, look, there's no regulations in our state for a dental practice trying to do this.
Right.
So I'm like, interesting. It took me like a 5-10 minute call. And some states may vary. You know, California took me quite some time. But all I'm trying to say with regulations, if you're concerned, if you really want to do a membership program, you know, to generate recurring revenue, the patient loyalty factor, have control over your fees, and build essentially a fee-for-service patient base, much like a insurance company builds their revenue, right? You could have that same model in your practice. But if that's something you're really considering doing and you're afraid of the regulations, don't be. It's not that hard to call the insurance commissioner, or even I'm willing to do that. My team are willing to do that for you. If you're interested in creating a membership program, you know, with our software, I'd be more than happy to call your state if I haven't already. I collect all the data, but regulations you shouldn't overthink them like most practices do, and you shouldn't be scared of them. They're here to protect both the patient and the practice. And basically, if there's questions, you can make a 5-10 minute call to the insurance commissioner team and ask, and they'll give you the data. It's that simple, right?
Yeah.
And for months and months, I've heard just the topic going on like Dental Town and other people just talking about it. Like the regulations have been a big thing that practices are scared of. And all I'm trying to say today is don't be scared of the regulations. It's not as complicated as you're making it sound.
Yeah.
Right? That's really kind of, because I mean, I'm proof. I've called California, and I've called Wisconsin, I've called Oklahoma, and a bunch of other states, basically because some of our customers or potential customers were worried about it. And I'm like, look, I'll do some legwork for you in your state. And obviously I'm not an attorney, but I can call and ask one of their attorneys.
Yeah, exactly.
Right? It's really not that hard. So don't let the regulations scare you on membership programs, and you'll find that by implementing one, you've been missing out over the years of generating recurring revenue, controlling your fees, building that loyal patient base, like Dr. Phelps describes, you know, in his book and on his episode with us. But that's what I have to say about the regulations today, Ben.
Yeah, no, I think that's key because even in almost many aspects of billing, the dental offices are being given information that is not true. And sometimes I wonder if that's being fed to them by the insurance companies, you know, that you can't do this, you can't do that, you can't do this. And then the people that suffer are the patients, you know. And
true, yeah, very true.
Like there are a few laws that are out there that have come onto the books recently. If one of which is non-covered service law. If you have a law like that in your state, you need to know how that applies to you and how you can improve practice there and how you can improve income. Federal plans. It's so funny. Last week I was in Costa Mesa, California, giving a presentation, and I asked people in the room, has anybody in here ever called the insurance commissioner on any item? And I was talking about Tessina's case, about how Tessina got the insurance commissioner to stop certain insurance carriers from bullying her and her doctor. And one person raised their hand.
Great resource,
I know.
I think. Yeah,
one person raised a hand and said, I called the insurance commissioner on this one issue about a federal plan, and the insurance commissioner came back and basically told me there was nothing I can do with the federal plan because it's governed under federal and all that. And because of that, I don't call them anymore because they're not that helpful. And I said, well, how many times have you called them? And she said, just on this one issue. So you mean to tell me that you're going to give up because you didn't get the answer that you wanted on the first call?
Yeah.
And then I asked her, what else are you experiencing? Do you get denials on scaling and root planing? Do you have a membership program that you have questions about? I said, yeah, we don't appeal those anymore because our thought is that if it's denied, you know, it is what it is, you know, and we don't do membership programs because there's just too much regulation. And I'm like, you know, I don't know who's giving you advice out there, but so many offices are being intimidated out of doing things that are good for the patient or even good for your practice by way of you getting paid on a procedure that you already performed, that you submitted to insurance and got denied. And it's all this, there's too much regulation, I just don't want to deal with it. But you'd be surprised.
There's really not.
Yeah.
There's really not.
You'd be surprised.
a few here and there that that are pretty standard and pretty easy to accomplish to get to have that get through the regulations.
Yeah.
But people think that they got to fill paperwork out. In some states they do, right? Like California, but it's really simple. I've talked to every time I call an insurance commissioner or that department, right? Someone in that department, they've always been extremely helpful.
Yeah.
Like more than like I've tried calling like a dental association in a state, and they won't even talk to me. They're like, "Well, you're not a dentist,
You're not a member." Yeah.
Right?" And I'm like, "Well,
You don't pay your
how do
taxes,
I get
Jordan, so they don't.
Yeah, yeah. So I'm like, how do I get the information that is needed without like I don't feel like I need to pay a membership fee to get certain helpful information to help a practice out, right? But that's just how the dental associations work. But with the insurance commissioner, I've never had to pay anything. They've never asked if I was a dentist. In fact, I tell them that I'm not a dentist, that I help dentists create these through our software program, create membership programs, that is. And basically, they've always been extremely helpful to me and to my customers that use our software. And I've never had one say, "No, I can't give you that data because you're not a dentist," or because you're calling on a dentist here and you're in Utah, right? And you're calling into a different state. But I don't know. I mean, I'm assuming you call the insurance commissioner a lot more than I have been. And have you seen the kind of the same thing?
Yeah, I've talked to insurance commissioners and the attorneys there in multi-states, excuse me, hundreds and hundreds of times. And it's just all about the questions that you ask. Number one, you're trying to find ways to be compliant with the state, and you're not looking for loopholes. You're not looking for handouts or favors. Number two, you're calling on behalf of the patient to advocate for the patient and the patient's best interest.
Absolutely.
And getting the insurance carrier to pay a benefit that the patient paid for in the form of a premium, where the insurance carrier is restricting and limiting those benefits. It's all about the ask. But even if you don't ask the question correctly, they're not evil people. They're actually very wonderful, and they're very easy to work with.
They've always been helpful to me.
It's like
I've never had any issues.
It's like they don't get calls from the dental offices all that much, and it's surprising because I was speaking to the insurance commissioner in Utah, and they're like, "We've started to get a lot more calls from dentists these days. Do you have anything to do with that?"
Yeah. I called one state about membership programs. They're like, "Man, we're getting an influx of questions about these membership programs." And it's a state that I'm in quite a bit. We have a lot of customers in the state. I'm like, probably a portion of that is from my doing.
Yeah.
Because we have a lot of customers in this certain state. And anyways, the only thing that I've heard from an insurance commissioner they said, well, if you can, basically they said, if you can get the answer and if you can help educate the patients, that saves us time, because instead of getting, hundreds of calls in each week, we get a call in from you, Jordan, about these, and then you educate all your customers on them.
That's
right?
exactly right.
That's like one of the things I've got. I'm like, well, that makes sense. Like, I'm here to help as much as I can. Obviously, I'm not a lawyer or I don't work for the insurance commissioner, but I obviously want to educate the dental market on regulations for membership programs, and anything else that is applicable to that. In your case, Ben.
Yeah, you bring up a good point, and maybe we can close on this note here.
Yeah.
So the insurance commissioner has no interest in repeatedly taking the same issue from the same person over and over and over again. They just can't afford to keep entertaining that same person, the same issue all the time. So this is something that the insurance commissioners have told us, is that if there's an issue with the insurance carrier, we're going to put a halt to it now, because we just can't afford to keep getting calls from you on this same issue. So the nice thing is that if there is a legitimate ethical or legal issue with how the insurance company is treating an office with claims, they put a stop to it. They send out a full-on cease and desist and a fine and a threat that if the insurance carrier doesn't clean up their act, they're gonna lose, or at least run the risk of losing their right to sell their dental plans in this particular state. So the insurance commissioners are great at resolving issues forever for any particular, well, I shouldn't say forever, but at least for a good amount of time. On Tessina's issues that we talked about on the podcast before, she still hasn't received a an issue with those two insurance companies that she had the insurance commissioner send cease and desist to. So it's nice because you get an issue resolved, a regulatory issue resolved, you get a claims issue resolved, and that's the end of it. They don't want to hear back from you.
Absolutely.
So they bend over backwards to make sure that your issue is done so they can move on, you know?
Yeah, because they don't have a big team, right? And they don't have the ability to scale hundreds of issues, right? So if they're like, well, if this is an issue, like let's take care of it now, so it's not a big problem for our small team, right?
Yeah.
With the insurance commissioner, you know. And I do like to end with one more thing is oh, I just totally spaced it. I was thinking about when you were talking. I'm like, it was so good, but I totally spaced it. It had something to do with regulations again on membership programs. A lot of practices think that membership programs fall under insurance regulations. Now, this is according to the state of Oklahoma. When I spoke to the lawyer there, they're like, well, this doesn't fall under insurance, so it does not regulate it under insurance. So keep that in mind with membership programs. A lot of states don't. It doesn't fall under insurance, so it's not going to have the same regulations as insurance.
Right.
And that's kind of the last topic that I wanted to end on, Ben. I'm glad I remembered it because it was good.
No, that was good. That was good. Well, 50 minutes into the program, we appreciate all of you listening. Yeah. If you have any questions about regulatory issues or the UCR stuff that we talked about, send us an email. Our email is posted in the show notes, and keep your eyes on the road. But thank you so much for listening. If you have a topic suggestion, we do have a lineup of guests coming over the next few weeks. But if you have a topic suggestion, or if you want to be a guest on our podcast for anything that you want to share with our listeners, send us an email.
Yeah,
totally. We'd love to hear from you. But otherwise, keep the questions coming. Thank you so much for listening and supporting our podcast. And, like we always say, if you don't like this show, then, we'll give you a full refund.
A full free refund.
Thanks for your time, Jordan, today. And everybody have a great day today. Enjoy the sun.
Yeah, thanks, man. All right. Let's see you.
All right.